Okay, for today's activity, we'll be doing here the reticulocyte count. So, reticulocyte is actually the immature precursor of your RBC. So, this is the stage of the RBC series where that's right before the mature RBC. So, we are doing here the reticulocyte count as the measure or the index of effective erythropoiesis. So by checking here the reticulocyte count, we're able to assess if your bone marrow is producing here the new blood cells or new red blood cells as the compensation for those patients having that hemolytic reactions. So since reticulocyte is the precursor of the RBC series, so eventually this would measure if your body or your bone marrow here is producing young or new red blood cells which has been lost or because they have been ruptured because of some hemolytic reactions. Okay, so reticulocytes usually stay 24 to 48 hours before it become here mature RBC. Okay, and this is also identified here by having fine reticulum of the RNA, which could be stained here by our supervisor stain. So the supervisor stain that being used for staining of your reticulocytes, we have here your new methylene blue. Again, we speak about supervisor staining. This is a special type of staining procedure wherein the cells were able to take up the stain even they are on the living state. Usually, ang principle natin, ang cells natin, were able to take up the stain when they are already dead. But here in this reticulocyte, so the supervisor staining, those are the cells wherein they are capable of taking up the stain even they are still alive. Okay, so the stain used here for the reticulocytes, we have your new methylene blue. Okay, we have here your young reticulocytes, most likely contains here much of the reticulum of the RNA. But to try to mature, so nawawala ang reticulum of the RNA. Therefore, your mature reticulocyte would have your few amount of your RNA present. Okay, then we have here the procedure for your reticulocyte count. So we have here your dry smear method. So procedure for this one, so just need to collect your blood. So we will be needing here the EDTA collected blood. Then we'll be using here also, we'll be needing also here your stain, your new methylene blue. So procedure for that, we have your equal volume of your blood and your stain. So we have your 1:1, the ratio of your blood and your stain. So pag sinabing 1:1, so 1 part ng blood, 1 part ng stain natin. Or simply, like, if you're using here 1 ml of your blood, then dapat ang ating stain is also 1 ml. Okay, then just put that one in the test tube, or you could have also 1 drop or 2 drops, basta pareho sila ng volume. The second one here, so you put that one in a test tube and then try to mix your blood and your stain, and then allow it to be incubated to stay at room temperature for 15 minutes. So the incubation here at the room temperature for 15 minutes would allow your reticulocyte to take up the stain. Then at the end of your incubation period, you just need to remix again. Mix again your tube. Okay, then get a drop of your mixture and then put that one in your glass slides and then try to make a smear. Since medyo liquid ang ating mixture, so do not expect here na ganun ka-perfect ang smear natin. Another thing about dito pala, you can adjust your anticoagulant, your blood and your stain na ratio. I mean like if the patient is anemic, so pag anemic ang patient natin, konti lang naman ang mga red cells, so you can have here mas madaming blood, konti yung stain. Or like for example, if the patient is sobrang lapot ng dugo, too viscous, too concentrated, hemoconcentrated, like in the case of your dehydration or even polycythemia vera, then you need to have here, dadamihan mo ang stain kasi sobrang dami ng blood or RBC patient and allowing it na magkaroon ng stain ang ating reticulocyte. So, medyo dadamihan natin ang ating stain. So, but then, pag normal naman ang patient, then you could have the 1:1 ratio. Then after that one, after you make a smear, try to air dry. And then try to examine your smear. Okay, you start examination in the feathery edge. Okay, the feathery edge, you start on that because of course it's the area where, so kung ito ang smear natin. Okay, you start here examining the feathery edge because it's the area wherein your RBCs are not overlapping. And therefore, it will be easy for you to identify your reticulocytes. It would be difficult for you then to identify the reticulocytes because most likely kasi ang smear natin, hindi ganun, do not expect na ganun siya ka-blue na color ng entire smear natin because it would have here appeared like mga, parang ano lang siya, greenish ang color ng smear natin. And your RBC would looks like almost colorless to greenish. And then just need to identify your reticulocytes as differentiated from your debris, as differentiated from your artifacts, and as differentiated from the normal na RBC. So just need to look at the center of the RBC kung meron siyang mga reticulum of the RNA. So pag mga ganon-ganon. Okay, that's your reticulocytes. Okay, so examine here on the feathery edge. You start on that because okay, that's the area wherein the RBC are not overlapping. So do not go here on the thick area kasi mahirap mag-identify ng mga reticulocyte in this area because the cells here are overlapping. Okay, then you try to examine that one in the OIO, oil immersion objective. So you'll be requiring to count here 1,000 RBC. Since 1,000 RBC ito, then we just assume na in every one OIO field, that's 100 na RBC. Because actually, pag tinignan natin under the microscope, hindi natin mabibilang ang mga RBC natin because they tend to overlap. They tend to form here a rouleau formation. So, medyo mahirap siya na i-count. And therefore, gagawin na lang natin is just estimation. We just assume here na in every field, OIO field, there are 100 RBC. So, pag 10 field ang i-examine natin, so that's 10 times 100. That gives you here 1,000. Okay, that satisfy here the requirement na you need to count here 1,000 RBC. And just need to write here, okay, so ganito siya, parang ganito. Gagawa ka ng table na representing here each of the fields. So, first field, second field, hanggang 10. And then, ika-count mo lang ilan ang nakita mo na reticulocyte in each of the field. And for example, field number 1, OIO field, the first OIO field, you have here, okay, you identify 5 na reticulocytes, and the second one, 3, 2, 1, and until you're able to have here the 10 na requirement na OIO field. And then you just need to total kung ilan silang lahat. And that become here total number of reticulocytes in a 10 OIO field over 1,000 times 100. That become your percent reticulocytes. Okay, so that's it for the procedure of your reticulocytes. Okay, thank you.